This is critical thinking on the skeletal system, and here are the questions. So this is the first question, the second one, and here's the third one. Now in the lecture, you don't do every bone of this skeletal system, but you do certain bones, and I mentioned nerves related to those bones where it's extremely important to pay attention to those, and it's more general, whereas in the lab you do the bones in greater detail. However, let's look at this question first, which tells you that Roger is 4 years old and he fell and fractured his radius. It then tells you that the fracture line passed through his epiphyseal cartilage. So these are the two keywords here. Also the fact that this is a 4-year-old child. So then the choices given are, what will this fracture do? So it says here it will cause numbness and tingling in his hand. Now this numbness and tingling happens whenever a nerve is compressed. So this is the radius and it's at the epiphyseal cartilage, so it could be either at the upper end of the radius or the lower end of the radius, and no main big nerve is very closely related to either ends of the bone. So therefore no nerve is going to be compressed, so this is not the answer. This numbness and tingling in the hand usually happens if either the brachial plexus is compressed, like for example when you have a cervical rib, or later when you do muscles you'll hear there's another nerve known as the median nerve, which passes through the carpal through the anterior aspect of the wrist in what is called the carpal tunnel, and that's called the carpal tunnel syndrome. So there again, if that is compressed, you get tingling in the hand, but it's not because of this fracture. Then it says this could injure the axillary nerve. This also is not a choice because the axillary nerve is related to the surgical neck of the humerus. So again, if you look at the humerus here the axillary nerve is related to the surgical neck of the humerus. Here we are talking about the radius, which is a forearm bone. So it's not going to be this. The next one, injure the radial nerve. This again is not a choice because the radial nerve is very closely related to the posterior aspect of the humerus and passes this way through to posterior aspect of the diaphysis or shaft of the humerus, so not the radius, so hence it's not going to be this answer either. Then the next one, interfere with interstitial growth of the radius. Interstitial means growth in length. And yes, this is the correct choice because the epiphysis is responsible. This epiphyseal cartilage is responsible for growth in length of a bone. So, you know, when, for example, let's say the radius is, so this is the upper end of the radius. So there's a cartilage bit here. And then this is the rest of the bone. And then there's a cartilage bit close to the lower end, so the lower epiphyseal cartilage or the distal epiphyseal cartilage. This is responsible because it keeps forming bone at either end this way, and this causes increase in length of the bone. So if the line passes through the epiphyseal cartilage, naturally it will damage the cartilage and hence interfere with interstitial growth, which is this growth in length. So this is the right answer. But let's look at the other one too, which says interfere with intramembranous ossification. Now, intramembranous ossification is ossification which occurs in flat bones. The radius is not a flat bone. So it does not undergo intramembranous ossification. It undergoes what's known as endochondral ossification. Hence, so this is not a choice. So the correct choice is this one. Now let's look at the next question, which tells you about this lady who is 9 months pregnant, has an ultrasound, and the ultrasound image shows ossification in the center of the femoral shaft. Shaft is another word for diaphysis, and you have to see what is it most likely due to. So the first choice is a callus formation. A callus formation happens when there's a fracture. Now this is a 9-month-old lady, and a lady who is 9 months pregnant. So there is nothing in this to show you that there was some injury or anything that happened to the fetus. So hence this is not a choice. Second one, the knee joint, this obviously is not a choice because one, this says the center of the femoral shaft. So if this is the femur and it's saying it's in the center of the femur, up here you see something. The knee joint is at the lower end of the femur with the tibia, where the lower end articulates with the tibia and the patella. So it is not this either. Then the third one, which says secondary center of ossification. Secondary centers of ossification occur at the epiphyseal ends. So it's not this one. So a secondary center of ossification occurs, at the head of the femur, the trochanters, and the lower ends of the femur. So it's not this one. And while in the femur, a secondary center of ossification may be seen in intrauterine life, most secondary centers of ossification appear after birth. So hence it's not this choice for that reason too. So this, it leaves us with the last one, and it is this choice. One, the primary center of ossification occurs in intrauterine life. That means while the fetus is still in the uterus. So here we are saying she's 9 months pregnant. She hasn't delivered as yet. So it's still intrauterine life. Plus, primary centers of ossification occur in the shaft or the diaphysis. So this fulfills both of those requirements. So hence this is the answer to this question. And let's look at this last one where you have to identify the incorrect statement. So let's look at all of them. The first one is that the head of the ulna lies at the lower end of the ulna. Now this is a true statement. If you look at the ulna, the upper end of the ulna has the olecranon and the coronoid process. It's kind of beak-like. And you come down to the lower end, and then you have a rounded part, which is the head of the ulna, and this little process which is called the styloid process. So this is the styloid process, and this is the head of the ulna. So that is true. The lower end, or also known as the distal end. When you look at bones, you're allowed to use lower end or distal end. So this is a true statement. This statement, narrowing of the intervertebral foramen will compress the spinal cord. Now this is false. So this is the answer to this question, because if you look at the intervertebral foramen, the intervertebral foramen is the foramen between two vertebrae up here. So if you see two vertebrae and there's a foramen present between them, passing through this intervertebral foramen are spinal nerves and blood vessels. So if this is narrowed, it will affect the spinal nerves and blood vessels, not the spinal cord. The spinal cord will be affected if the vertebral foramen, so if you look at a vertebra this way, and this is the foramen, if this vertebral foramen is narrowed, that will affect the spinal cord. So therefore, this is a false, incorrect statement. So this is the answer, but we shouldn't go down and look at all the other choices. The next one is bone marrow biopsies are done from spongy bone. This is true because bone marrow biopsy, so this one is a true statement. So this one is the false statement and hence the answer. Bone marrow biopsies are done from spongy flat bones, for example, the sternum, the hip bone. These are two bones which are taken where, they're easily accessible, they are flat, and you have a lot of spongy bone, and you do bone marrow biopsies from there. So that is a true statement. And this statement, fractures of the clavicle are most common where the bone is curved and changes direction. This again is true. And if you look at the clavicle, and let's say you're looking at the clavicle of the left side, and so you look at the clavicle of the left side, and draw the clavicle this way, and it changes direction. So between its medial 2/3 and its lateral 1/3. So it is convex here and then becomes concave. So that's where most fractures occur, and in children, of course, these are green stick fractures. So yes, this is true. So this statement is also true. So this is the only false statement, and hence is the answer to this question.